morning, and you got me this morning all shoveled. Worked all night, and easy saving lives, guys. Oh, my beard is all messed up, bushy-eyed and the whole thing, but I had to come and get you guys at 9 o'clock every Saturday. 92.9 VOB. Yeah, living how to live longer and those type of things, and we talk a little bit. This is your program today. Call me. I ain't come prepared for nothing, so because I had a hard night. I'm gonna go home and sleep for a few hours, but your program, your time, this is your show. You call in, 2-3 people can call in. You wanna talk about heart? We talk about heart today, and in this country, 1 heart attack a day, 1 stroke a day. You imagine that? 365 heart attacks every year. And what's the national average? A half. Well, 1/3 of those people don't make it to the hospital, so you have 1/3 death, sudden death. Well, here in this country is 67%. Why is that so high? It could be people are taking a long time to get to the hospital. No, you get pains in your chest, or you feel very like you want to faint and those type of things. Palpitations. You make sure you grab, get an ambulance or get somebody responsible. Take you over there to one of the emergency clinics or or on the hospitals and get taken care of. This thing, heart, can take you out in a minute. So I'll be back in a few minutes. We talk about heart, we talk about stroke. I want to big up Xavier. I've been looking for you, Xavier. Yeah, 11-year-old nice boy. Oh, he is a wonderful, strong kid. Morning to you, Xavier. And I'll see you sometime next week. And we have some other people, Brian McKee and Doreen from Lucky Horseshoe. These people I want to big up. And then there's a nice lady I met this week. I can't remember your name, girl, but you got to understand. If you're sleep deprived, you forget stuff like crazy. Don't remember your name, but you know this. You know who I'm talking about, because I'm sure you're keyed in there listening. You sweetiful, nice, beautiful African queen, and you came to see me this week, so I want to big you up. Next week I'll remember your name, honey. Okay, so I'll be right back in a few minutes.
Morning time, y'all. I wanna be lively myself, y'all.
Okay, that was lively up. You sit down and you make sure you take some antioxidants, vitamin C, vitamin E, all this caffeine, actually, coffee, if it's good, if you don't have palpitations, of course, and green tea, good for you. Those things decrease the plaque formation. And remember, plaques come from oxidation. So if you take antioxidants like the vitamin E and the vitamin C and the omega-3, omega-6 and 9, all those nice antioxidants, you can stabilize the process. 434-1771, 434-1790, and 434-1791. It's your calls. You call in anything about the heart you want to know today. We will talk about it. We said there, don't forget 434-1771, 434-1790, and 434-1791. Call us and we can discuss heart, anything related to heart. This wonderful organ that beats 120,000 times a day, And the day it stops, the word I use is relocate. And I should say to you, that's all we know. All we know now is what we're doing here in this world. You got a call? Yeah, you're on the air. Good morning.
Yes, good morning, Dr. Sparman.
Good morning.
Yeah, right. One of the things I want to find out is, what is your kind of status now in terms of working,
you mean in Barbados? Yeah, well, boy, you're talking about heart disease, but yes, I'm here to answer your questions. The medical council and of course, nobody has stopped me from doing cardiology or surgery. They haven't made it. The medical council, even though the paper may show that they're saying the conception is that Dr. Sparman cannot practice. No, it's not so. Dr. Sparman is the Sparman Clinic every day works. Surgery goes on every single. Matter of fact, I had surgery all night. So, yeah, we go on 24/7. We are there for you. So, no, our status is the same. It's just that you may hear things and never believe everything you read. I thank you for calling, sir. Is there anything else I can do for you?
Good morning, Dr. Sparman.
Good morning, ma'am.
My favorite doctor.
Yeah, good morning.
Yes. Can the heart valve repair itself?
Most times what happens with the heart valves, if it's leaking, more so. Sometimes it stays like that. You can live for 100 with that. However, if it's blocked or stenotic, means a lot of blood is not passing through. Most times that, if it gets worse, needs surgery. There's something called valvuloplasty or repair of that valve. It depends on the effect it would have on the heart. If it's causing the heart to get weak and enlarged, yes, you may have to take care of it. But sometimes you have a murmur, which is a heart leaking valve or so forth, and you can live with that for 100 or more. So
well, that's good.
Yeah, it depends on what it is.
Yes, but lifting things heavy, you know that is something wrong.
Yes. Palpitations, you're short of breath, difficulty walking and stuff, you know something is going on.
Yeah.
Your cardiologist should be able to help you.
Thanks very much.
Pleasure, ma'am. Thanks for calling.
Bye.
So we're talking about that, and the heart in itself, man, the major organ. Remember, everybody feeds, just as how we feed in the spirit. The heart feeds in the heart, and the body feeds in the heart. If I may correct myself, so the kidneys and the lung and the liver and the brain, they all feed on the heart and sustenance for blood and nutrients. So we're talking about stroke. You have one stroke also. You have a call. Yeah, I'll take that call. Good morning.
Good morning, Dr. Sparman.
Good morning, ma'am.
Good morning.
How are you?
How are you doing?
Not bad, ma'am. I'm here, doing the good thing, living.
I know you are.
You hear me breathing?
Yes, I do. Do you hear me breathing?
I could hear it, too. I feel you, too.
You almost lost me, but I'm still here.
You're kidding. I almost did?
Yeah.
Oh, man, was it a bad experience?
No, I fought. I'm a fighter.
So you
I'm a survivor. I'm here.
You came through the fire?
Yes, I did.
Stunned but sober.
Dr. Sparman, I really wish you would advise your callers again about before or while they're waiting for the ambulance to come.
Mm-hmm.
You talked about the aspirin. I've read up on this aspirin. They really need to take some aspirins before they go to emergency.
I agree with you, except they're allergic to it. Yes, if you got chest pains or you have any, you feel like if your fluids in it, you can't breathe at all, and you know there's a heart problem, go for the aspirin. Most times it's a heart attack, and it used to be an apple a day. It's an aspirin a day. And if you're having that problem, you know what? You take an aspirin, 325 milligrams, put it in there and take it. It can stabilize the clot that is forming there. It's a white clot, they call it. So yes, I agree with you. Everybody should have an aspirin, a bottle of aspirin in their house.
One more thing, Dr. Sparman.
Yes.
Can you just put it under their tongue till the ambulance arrives? Like under the tongue so it dissolves even quicker?
Well, the thing is, even if you swallow it, taking on the tongue is fine. The nitroglycerin on your tongue works very fast, but there's some of them, you're right, that are not coated, that you can put on your tongue, and things under the tongue normally can dissolve very quickly. But some people get problems with that because it's a big tablet, and the tablet takes a while to get. You swallow it. That's the way to go.
Okay, thank you very much.
Pleasure, ma'am. Thanks for calling.
Thanks for all the work.
Yeah, thank you. Yes, we're talking here. The aspirin is extreme. Oh, we got a caller. Good morning.
Hi, good morning.
Morning, ma'am.
My daughter, she's 22 years old, and her platelet count was 790.
Okay.
And 15 days after taking aspirin, it came down to 111.
Oh.
So, I was wondering if aspirins are good enough for her to be taken constantly.
Well, that's a very, very strange thing because normally aspirin itself inhibits the function of platelets. In other words, it makes it dysfunctional, but it does not cause a decrease in the amount of platelets. It just make you have some platelets that are running around that doesn't work properly. That's all. So really, 790 coming down to 100 and something K or 1,000 doesn't seem that something will be the natural cause. Aspirin will be the natural cause for that. I think it could be true and unrelated. She could have had some type of process, an inflammatory process that caused her platelets to go up, because sometimes it responds to these reactions like that, and then it just came down by itself. But aspirin itself just inhibits the function and not the number of platelets. So it means that how old is she?
22.
Yeah. Aspirin, I don't know if she should take aspirin. I mean, that's a kind of young age for aspirin. But if she got a problem, that a blood clotting disorder or some type of disorder that needs some thinning of the blood or having the blood thinned, she may need that. So the doctor can advise you appropriately.
Okay.
Thank you. Thank you, ma'am. Yeah, so, we're talking about that. So aspirin is one of the drugs that you should take. Everybody should have one of those in their homes. You take one of those, as a matter of fact, every day. If you're 40 or over, you take one baby aspirin. Don't forget, if you don't have heart disease, take one a day. Somebody's going to call. Good morning, you're on the air.
Good morning.
Yes, how can I be of service? Could you, don't listen to the radio, my dear. Just speak to me.
Yeah.
You can turn the radio off, because there's a background noise there with the radio. Thank you.
Oh, yeah.
How can I be of service to you today?
I met the doctor last month. He said my blood pressure was 240 something. And he gave me a top mark Concord.
Okay.
He said that will help you out with start working so fast.
Okay, yes, Concord slows the heart, and also it can bring the pressure down also.
Yeah, that he told me.
But 240 is kind of high, ma'am. That's stroke pressure.
Yeah, he told me that.
You need more than that. I hope you have concomitant or some other pills.
No, and I have Met.
Okay, Aldomet, right?
That's one.
Yeah, but yeah.
Okay, man.
The Diavan is extremely nice. Diuretic would be good for you. Hydrochlorothiazide or amilzide, one of those two.
Yeah.
They're strong, potent, the first line drug for people with high blood pressure like yours. And ask him with hydrochlorothiazide.
Yeah.
Wonderful drug. 50 milligrams a day, taken along with Diavan and your Aldomet will definitely bring your pressure down. But 240, one day you could really end up in a very, very compromising position. Not a good pressure to have.
Yeah, he told me that.
Yes, ma'am.
He gave me Alopane too.
Yes, well, you make sure you stay away from a lot of salt. You should eliminate salt completely from your diet.
Yeah.
All right?
Yes,
Keep
please.
that pressure controlled.
Okay, thank you very much.
Okay, then. Yes, so, yes, we're talking about aspirin. People who cannot take aspirin, Plavix, good alternative. Yeah, 75 milligrams once a day. It's good for you. Some people may be allergic if they have asthma and so forth, allergic to aspirin. Plavix is a good alternative. It's expensive. But think about it. You get a stroke or you get a heart attack. How much money you have to spend if you survive? How much money you have to spend for care after? I say preventative medicine is the way to go. You take one Plavix or one aspirin every day. Yes, you'll be good. Don't forget the other things we always talk about, the fruits and eating very well. Stay away from the saturated fats. Stay close to poly and mono saturated fats, or unsaturated fats actually. Monounsaturated and polyunsaturated fats. Stay away from the saturated ones. And stay away from the trans fat where you get from a lot of fried foods. Okay? And don't forget, guys, things like a lot of people, a lot of salted nuts. Almond nuts is the way to go. So we will deal with that. So we were talking healthy stuff, how to keep you from this heart attack. One a day in this country is too much. Yes, we got somebody in the air. Yeah, good morning.
Hi, good morning.
Yes, good morning.
Couple of questions regarding aspirin. When you're taking aspirin a day, if you should happen to then get the hemorrhagic version of dengue, would that have a serious effect on you, or would stopping the aspirin immediately start to an effect on help you in that situation?
Yeah.
And secondly, if one has maybe an ulcer, you don't know that it might be a slow bleeding ulcer, and you're taking these aspirin every day, how would you know that that's having an effect on that particular ulcer?
Yes, good. Very good question. The first one, hemorrhagic dengue. Very, very small population of people will be exposed to hemorrhagic dengue. A lot of us get dengue year-round. Very, very serious, weakening, viral type of infection you get from the mosquito bite. But the thing is if you're taking aspirin, you stop it. That's all. Just stop it.
Okay.
And this should be able to do the job for you. Don't continue taking it, or anything close to aspirin like Advil or anyone who's naproxen. If you take anything for pain, it got to be Panadol, okay?
Right,
so
okay.
You stop it, and then you move on from there, because dengue is going to be around for a good week before it really finishes. All right,
right.
The other question is in reference to if you have an ulcer. If you have an ulcer, Plavix might be a good thing to switch to. And if you're taking aspirin, take a baby aspirin along with some allicid to coat the stomach. These are proton pump inhibitors, allicid or omeprazole and Nexium. Those things, even though the aspirin would have an effect on you also, because of the coating and the nice soothing effect and the decrease in the acid secretion in the stomach, it wouldn't be so abrasive to the ulcer that you may have. So if you have it, there's no contraindication per se. Well, not absolute contraindication. It may be a relative contraindication. So you can take it with one of these things. Nexium I prefer. Take that before you take the aspirin, the baby aspirin, you'll be fine. And if, for some reason, and every now and then you can do a small occult test or Guayat test of your stool to make sure you don't have occult bleeding or bleeding that you can't see. And follow with the hemoglobin. But I say Plavix would be a good alternative. You don't bleed as much as Plavix.
Okay, great. Thanks so much.
Pleasure.
Take care.
Yes, so we're talking lots of things today. Any calls, I'm there to answer, guys. As I said, this program I give to you because I didn't have time to prepare today. Cupid has seen me here, my scrubs came straight from the clinic, and I had to be here because I know my people are sitting down there at the radio waiting to hear good food for thought. So we talked about things that you should eat. Just drink a lot of water. We got a call. Hey, good morning. Morning, you're on the air.
Yeah, good morning, Dr. Sparman.
Yes, good morning, ma'am.
How are you this morning?
Not bad. How can I be of service?
I appreciate the advice that you're giving to people.
Yes, ma'am.
That we could sit here and listen to it free. Mm-hmm. And I appreciate that very much.
Pleasure. It's a
pleasure.
But
one of the things I want to ask you is just to talk about the baby aspirin.
Yeah.
How you have to take it every day?
Yeah, every day, one a day. Baby aspirin every day, 81 milligrams. Pop one in morning or afternoon, doesn't matter. It'd be nice. Just take one a day. Let it be a part. Make believe you're taking a vitamin.
Okay.
Listen, it'll give you at least 10 to 20 years of your life.
Okay.
Easy.
I do appreciate it. I'm a person in my 60s.
It's
And I started to take them, so I just want the right information from the right person.
Yeah, and as a matter of fact, I'm younger than you, and I take it, so you know.
Okay. I appreciate
I'm leading the way.
I also appreciate the program that you all have on TV.
Oh, okay.
You and I learned so
doctors.
much.
Yes, good. I'm glad.
Sitting and listening to you all talking, I said, look, I'm receiving advice in my house
there you
that
go.
I should be paying for.
Yes.
And I thank you all very much.
Pleasure.
And I hope and pray that the Almighty would give me the strength to feed us with the knowledge that you know, and we that sit down and listening to it would also act and work according to what you all say. Okay?
You bless my heart,
so
ma'am. Thank you. Keep listening and keep looking.
All right, I will do that.
All right, thank you.
Yeah, brother.
Yeah, so that aspirin is very, very important. So guys, yes, once you're over 40, don't forget, baby aspirin a day. Not being asking for too much. You can take your multivitamins too, but it's necessary. You see, the platelets come together. We were talking about platelets earlier, one caller. And the platelets normally, you have the arterial tree and the venous tree, where the arteries take the blood away from the heart and the veins bring it to the heart. So you see, if you have a blood clot in the arteries, you could have a heart attack, or if it's the ones going to your heart. If you have a blockage in the arteries going to the brain, you can have a stroke. And then if you have the blockage in the arteries going to the kidneys, you can have a kidney infarct, and so forth. The organ that is fed by that, I'll take that call. Good morning, you're on the air.
Good morning, Dr. Sparman.
Good morning, ma'am.
Right. I am diabetic.
Mm-hmm.
I have thyroid, total thyroid,
okay,
and hypertension.
Okay.
So I can take the baby aspirin also.
Oh, you need it more so.
Okay.
Diabetes, hypertension. You didn't tell me about high cholesterol, did you?
Yeah.
Yeah, you got that too. Yeah, those three guys are like the three stooges. They hang out together. So you're at high risk. That's 3 risk factors right there. And your age may be more than 50, am I right?
Yes, you are.
Yeah, there you go. And then you may have a little extra weight, am I right?
Yes.
Yeah, you see, I don't know. You think I'm seeing you right now? So 5 risk factors right there. So yes, you need it more than ever, sweetheart. Baby aspirin. 81
take one every day.
Every single day.
You can take that along with the medication.
Yes, there's no interaction between them.
Okay.
Take them. I say to my patients all the time,
Okay.
and live longer.
I just tuned in, so that's why I
Thank you, ma'am.
Yes, thank you very much.
Pleasure.
Okay.
Yes, we are talking about the things that you can do, and the saturated fats we talked about. Stay away from the saturated ones. And look up. You know what saturated fats are, and all those things with all the pizza and you name it, and all the pork and the red meat and so forth. They all got a lot of saturated fat in them. We take a call right now. Good morning, you're on the air.
Good morning, my favorite doctor.
Yes, good morning. Please take your radio off so we can hear you clearly.
Oh,
ma'am.
okay.
Thank you.
Just one
Thank you.
quick second.
Don't mean to be rude, but
Dorian.
okay.
The name you
Dorian,
forgot.
no, yeah,
Dorian.
you see that? I told you, listen, Dorian, big up to you, girl. How you doing? You African queen, you did okay. Oh my goodness. Hey, country, here, Dorian. She came back, she listened, and this is Dorian. Dorian, it's nice. Have a very beautiful Saturday,
too.
and may God bless you, and keep as beautiful as you are.
I will.
Thank you.
Thank you.
Yeah, so we talked about the various type of the fats and so forth. Don't forget, 6 to 8 hours of rest every night. That belongs to you, all right? Come off the computer and go to sleep. Rest that body. Why do you think we have night and day? There's a reason for that. Yes, if you try to stay up all the time, man, you stress your body out. Not supposed to happen. Your memory will go. You gotta rest and regroup. It's just like exercising, guys. Don't go to the gym every day. You burn yourself out and you drop off the bandwagon. Yeah, take 3 days to 5 days a week. It's good for you. So, have we talked about rest, drinking a lot of water? Oh, we got a caller. Good morning.
Good morning, Dr. Sparman.
Good morning.
Could you inform us about aneurysm?
Aneurysm, okay. Yeah. Which one you want to know? The one in the brain or the one in the chest cavity or the other parts of the body? Doesn't matter?
As much information as you could possibly give.
Yes, all right. The aneurysm basically is an outpouching of the arteries. If you think about it as a balloon, if you blow, you take a nice long balloon and you blow it and suddenly you see one part start to get engorged and open out, or you have a tire you're driving and suddenly a part of it just gets outpouched. You know why? That area is weak. So it's the same way, it's synonymous to the walls of the artery. If the walls of the artery in a certain area is a little weak, most times it's the media or the middle part of it. Then what happens, the pressure in the arteries push that part out, and that's called an aneurysm. It's like a little bump of that artery. So it mostly happens in the arteries because the pressure in the arteries are higher than the pressures in the vein. So if it's in the brain, an aneurysm can cause a problem. If it ruptures, you can die. You can have a hemorrhagic stroke. And a lot of times the blood goes all into the spinal fluid. A lot of these people die. So doctors will go in there and clip it before. Sometimes you get symptoms before. They clip it before it bursts. Same thing with aneurysm of the aorta, which may be ascending, descending, or lower in the distal aorta. You got those aneurysms there in the weak artery. If it ruptures, most people die. So it's good to find these things out early. And it even happen in your lower vessels most times when you have it in one area. Aneurysm should be...
Thank you.
Yeah.
Hello, good morning. How are you? Okay, I want you to hear ARA.
Yeah.
And does that have something to do with the heartbeat?
Okay, yes, ma'am. It basically is anything that is irregular. In other words, if your heart should beat 60 beats a minute, 100 beats a minute, bum, bum, bum. That's it. The lights start going bum, 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 bum. That's an arrhythmia, or bum, bum.
Too fast
So
or
too
slow?
fast, too slow, or mixed with extra beats. It's called an arrhythmia. So anything that's not a normal sinus regular rhythm is an arrhythmia. And you can tell there's a test called the Holter monitor and tell what type of arrhythmia you have. Some are very lethal, some cause a lot of problems, and some you could live with. So let your doctor determine. Holter monitor, that's a test for you.
Okay, thank you.
Pleasure, ma'am. Yes, you talk about rest and drink some water. 4 to 6 glasses of water. I got my water right there. That's me there. I just drank it, got my bottle. Water is good for you. At least 4 to 6 glasses of that. I got a caller there. Yes, hi, good morning, you on the air.
Hello, hi, Doc, good morning.
Morning.
Now tell me something, I've joined you in the program late, but I'm just wondering, all this information you're giving us, is it bona fide? Is it coming from a professional man?
Well, let me say this. If there is a professional man, it's me. Cardiology, that's what I do. And I should say for you right now, if you check, let me give you some of my qualifications. And you know, one thing about me, though, people never really have anything they never talk about my hands. Because they always talk about, everybody says that Sparman knows what he's doing with his hand. And for you to go into arteries and put in stents and all those type of things, is either I'm a genius or I'm well trained, because I'm the only guy that's been doing that for 12 years in this country. So it means that, but I'm not that genius, you know. I'm just a guy who work very hard and take his patients seriously. I did 4 years of college in Brooklyn, Long Island University. Then I went on to do 4 years of medical school. I got a scholarship because I did well in college, New York Medical College. Thereafter, I went off and do 2 years in Brooklyn College as a surgeon. Then I did 3 years of internal medicine, board certified in St. Luke's Roosevelt in New York City. And then I went on to do my cardiology in Jacksonville Medical Center in Florida. Well-trained cardiologist. So you're getting the word, definitely. And you checked them out on the net and everywhere in the books. They're all tight. I would not give you anything else that's good for you. So thank you for asking anyway. We're here to answer all your questions. Someone in there? Yes, so we're talking about drink. Yeah, we're talking about drinking water, 4 to 6 glasses every day. We talk about taking the aspirin every day. We talk about sleeping is 6 to 8 hours every day. Also decrease the amount of saturated fats that you eat and so forth. And exercise, important for you. 20 minutes of brisk, I say 30 minutes of brisk walking 3 times a week. Good for you. Don't do 7 days a week. The max is 5 days a week, so as you keep going. I've been exercising since I was 19 years old, and I didn't stop. You know why? Because I don't do it. I don't burn myself out. Good morning, you're on the air.
Good morning, Doc. How are you this morning?
Not bad. How can I be of service?
Yeah, there's 2 starters back to back. You advertise. I just assume it's a tablet for like pressure, Delafam or Delaware.
Oh, yeah. I know what you're talking about. DEAN. Dr. Alpha.
Right. That's what I want.
Can do to keep your heart good for your brain. And then study came. If you find you take caution, yes, don't take it. So for the people that cannot take coffee because they get nervous or because they get palpitations, they can take green tea. Yes, we'll take another call. Yes, hi, good morning, you're there.
How are you doing?
Not bad.
I'm going to say, listen, I just want to drink enough water, even though I eat a much of water, morning, night.
Yeah, well, that's good. Keep it up. Don't stop.
I does a lot of line dancing and ballroom, so I always keep it safe.
Yes, water all the way. Stay away from the sweet drinks. Water.
Even when I go to line dance, I carry my water.
There you go, my dear.
If I don't have water,
we got water plenty for. Don't stop.
You should dance when I cut it. Thank you very much.
God bless. We'll call, and then we go. How can I
out of your debt too?
If you could, as much as
right away.
Yes.
So a ton or pardon?
Your stomach is a little bit bigger than normal, right?
I was there, so it was, yeah.
Yeah, that's what happened. Bread, a lot of times it causes you to be bloated. So, if you could stay away from the bread, you win. Yeah, you win all the time.
Sweet drink?
Yeah, stay away from all that stuff. Go for Weetabix. Weetabix is a good substitute.
None. He said no Weetabix.
Oh, well, that's fine.
Nothing
Well, that's the idea. Keep it up. Yes, drink a lot of water. If you get a break.
I know too.
Oh man, sugar.
The drink.
Yes, we are. Listen to your doctor and follow him. We love you guys. We love you, Barbados. You keep on. We want to help to your country, and we want to live forever. Have a nice one until next week. Right here, 9 to 9:30, and VOB. And I thank you for listening.